So the skin is the largest organ of the body. You might also hear it called the integumentary system. Skin is the body's first line of defense, so it prevents microorganisms and other foreign materials from entering the body, and it also prevents excessive fluid loss from the body. It's vital in controlling body temperatures, and its sensory perception is an important defense against environmental hazards. So there's two layers, the epidermis and the dermis, and then underneath there's the subcutaneous tissue. If you turn to page, sorry about that, 143 in the book, there is a diagram of the skin. So the epidermis is the top layer. That's where the melanocytes produce the melanin that's responsible for skin color. So it lacks blood vessels as well as nerves. It is also where hair comes from. So hair follicles actually go deep into the subcutaneous tissue, but they're lined with epidermis. You can see this better illustrated in that diagram. The dermis houses sebaceous glands that produce oils, eccrine and apocrine glands, which are your sweat glands, capillaries, sensory receptors, nerve fibers, and veins. The subcutaneous tissue houses adipose tissue or fat cells. In skin lesions, the characteristics help make the diagnosis. They can be caused by systemic disorders like liver disease, systemic infections like chickenpox, allergies to different foods or drugs, or localized factors like exposure to toxins. The type of lesion is classified based on the location, the length of time it's been present, any changes that have been made over time, and the physical appearance, like the color, elevation, texture, type of exudate, and the presence of pain or pruritus. This is on page 145 in your book. It illustrates common skin lesions. And this is on, let's see, page 146 in your book. It's a list of the descriptions of those different skin lesions. So you guys should study this table. You will definitely see these terms again. So pruritus. Pruritus is itching. It's associated with allergic responses, chemical irritation like from insect bites, or by infestations of parasites like scabies. It's not totally understood, but we do know that there's a release of histamine in a hypersensitivity or allergic response that causes the itching. It can also come from mild stimulation of pain receptors by irritants. The most common signs and symptoms are redness and itchiness. Scratching usually increases the inflammation. It can actually even cause a secondary infection. Infection comes because if we scratch a lot, we'll break that skin barrier, and then that allows microbes to invade the area. In order to diagnose a skin lesion, we might culture it to see exactly what bacteria is involved. We can biopsy it to detect any cancerous changes in tissue. We can do blood tests to determine allergies or abnormal immune reactions, or we can do patch or scratch tests to screen for allergens and antigen antibody testing. We treat pruritus with antihistamines or glucocorticoids either topically, which is on the skin, or orally to reduce the itching. We try to identify and avoid the allergen that caused the irritation, and we advise against exposure to extreme heat or cold because this can further aggravate the irritation. We use different soaks or compresses with solutions to cool the skin and reduce the itching, and infections might require the use of a topical antimicrobial treatment. And precancerous lesions might need to be removed by surgery or laser therapy, electrodesiccation, that's just a fancy name for heat, or cryosurgery, which is a freezing with like a liquid nitrogen. Inflammatory disorders that we're going to talk about include contact dermatitis, urticaria, atopic dermatitis, and psoriasis. Contact dermatitis is usually caused by exposure to an allergen or by direct chemical or mechanical irritation to the skin. Allergic dermatitis can result from exposure to substances like metals, makeups, soaps, chemicals, or plants. And you can see this in the picture, the irritation caused from adhesive tape here. The irritation is in the exact location that the tape or bandage was. That's actually how we can usually identify the cause of that contact dermatitis. We see the location, the size, the shape of the lesion, and we can usually narrow it down to what irritant caused it. Sensitization happens with the first exposure, and then on subsequent exposures, signs and symptoms like a pruritic rash develop a few hours after. Direct chemical irritation doesn't involve an immune response, but it is an inflammatory response caused by direct exposure to substances like soaps and cleaning materials, or acids or insecticides. So the skin is usually red and edematous, and it might be pruritic or painful. Removal of the irritant ASAP is definitely important, and reduction of the inflammation with topical agents like glucocorticoids is usually pretty effective. Urticaria, this is hives. This is a form of a type 1 hypersensitivity or allergic reaction. It's usually caused by ingested substances like shellfish or fruits or different drugs. This causes a release of histamine that causes raised, hard, red lesions on the skin scattered all over the body. There's a picture on page 147 of your book. These lesions are highly pruritic. These are often a part of anaphylaxis. They can develop in the pharyngeal mucosa, and they can actually obstruct the airway. It's important to check for swelling around the mouth and to check the airway. It's also important to administer an EpiPen if it's available, and to seek medical assistance right away. And then we have our atopic dermatitis or eczema. It's common in infants, and it can continue into adulthood in some people. Atopic refers to an inherited tendency toward allergic conditions. In infants, the lesions are moist, red, and vesicular, which just means small blisters, and they're covered with crusts. It's usually on the face, neck, extensor surfaces like the creases of the elbows or the wrists, or behind the knees or the ankles, of the arms, legs, and then also in the buttocks area. In adults, it's dry and scaly with thick leathery patches, and it's very pruritic. Potential complications include that secondary infection, again, from that scratching. So we scratch so much because it's so itchy, and then we actually cause a break in the skin, and that can lead to infection. We treat this with antihistamines and topical glucocorticoids, and we advise to avoid against skin irritants like strong detergents and wool, and to adequately moisturize the skin. That will be helpful. And these pictures on this slide are actually on page 148 in your book. And then we have psoriasis. This is a chronic inflammatory skin disorder. It's usually genetic. The onset is usually in the teenage years, and there are periods of remissions and exacerbations. So it's kind of dormant for a while, and then it flares up for a while. Just know that it results from immunologic changes. The flare-ups are usually caused by, some sort of stress or some sort of, irritation to the skin. Lesions are usually on the face, scalp, elbows, and knees. They can be very itchy. They can even give like a burning feeling. We treat it with glucocorticoids, tar preparations, and if it's severe enough, we'll give medications like antimetabolite methotrexate. Those tar preparations it's coal tar to help slow the growth of these cells so that the skin can restore, and that can also help reduce the inflammation, itching, and scaling of the psoriasis. And those tar preparations come in the form of like different shampoos if it's on the scalp, or different like creams or ointments for the skin. Coal tar sounds a little intense, but it's actually it's pretty common. You can even buy these at the grocery store. Skin infections can be caused by bacteria, viruses, fungi, or other types of microorganisms or parasites that penetrate the skin through minor abrasions or cuts, or through inflamed areas. If a serious infection develops, it's important to culture the exudate to identify the causative organisms so that you can determine the appropriate treatment. Cellulitis is an infection of the dermis and subcutaneous layer of the skin. It usually develops secondary to an injury like a bite or a skin ulcer. The organism that causes it is usually Staphylococcus aureus or staph, and sometimes it's Streptococcus or strep. It usually develops in the lower trunk and legs, but it can develop anywhere. We see it a lot in the hands and arms too. We see it especially in diabetics or people that are immunocompromised, and in the legs and feet in people that have poor circulation. So some characteristics, the skin is red, swollen, warm to the touch, and painful. You might see systemic signs like a fever. You might see red streaks that run along the lymph vessels. We treat it with systemic antibiotics. We elevate the limb, and we use warm, moist soaks. Then we have furuncles or boils. These are usually caused by Staphylococcus aureus again. They begin at the hair follicle and they spread into the surrounding dermis. This is common in the face, neck, and back. Initially the lesion is firm, red, and painful. It's a nodule that develops into a painful mass that we call an abscess, and there's usually a large amount of purulent exudate here. Squeezing them can result in the spread of infection by autoinoculation. This is transferring of the microbes from one site of infection on the body to another site. Like you squeeze it with your fingers, you have the infection on your fingers now, or the microbes on your fingers, and then you scratch your face or whatever, and then it can transfer it. It can lead to cellulitis. And then the term carbuncles. Carbuncles are a collection of these furuncles. They come together and form a large infected mass. This picture is on page 152. Then we have impetigo. This is a common infection in infants and kids, but it also happens in adults. Again, it's caused by Staphylococcus aureus. It can be highly contagious. It's usually on the face. It's transmitted by direct physical contact or contact with infected fomites, like the hands, sharing and eating utensils, sharing straws or towels or whatever. That's why it's so common in infants and kids, because it's really hard to teach them, for one, don't scratch it because it's very itchy for them, and for two, wash your hands frequently, and then for three, don't share things like eating utensils, straws, or cups or whatever. So it begins as a small vesicle or blister, and it bursts and forms like a yellowish brown crusty mass. And under the crust, the exudate looks like honey. It's very itchy. Scratching it can lead to further spread of infection. In the early stages, we do give a topical antibiotic, and if the lesions are extensive, we will give systemic antibiotics. We can also treat it with antibacterial soaps. Then we have leprosy or Hansen's disease. It's caused by the bacteria Mycobacterium leprae. It's classified into 3 major types. The signs and symptoms vary, but generally the skin, mucous membranes, and peripheral nerves are affected, and the skin lesions are formed that can cause a loss of feeling from nerve damage. The damage can lead to the loss of limbs and other extremities, and it's diagnosed by examining a skin biopsy, and it's treated with antibiotics. And the viral infections that we'll talk about are herpes simplex and warts. Herpes simplex type 1 is the most common cause of cold sores or fever blisters, which occur near the lips. Herpes simplex type 2 is genital herpes, and we'll talk about that more later in the semester when we talk about reproductive stuff. In both types of herpes, though, the primary infection might be asymptomatic, and the virus remains in a latent stage where it can be activated, causing skin lesions. Recurrence can be triggered by infections like the common cold, sun exposure, or stress, and it's spread by direct contact with fluid from the lesion. It can be spread to others before there's an appearance of the lesions or after the lesions are healed. Potential complications are the spread of the virus to areas like the eye, we call that keratitis, a painful infection of the fingers, which we call herpetic whitlow. We treat these with topical or oral antivirals to shorten the duration of the outbreak. It can't be cured, it's only suppressed. So a lot of times, it is suppressed, and then if there's extra stress on the body or something like that, it can cause that flare up. And then warts. These are caused by a different type of HPV. They're spread through cracks in the skin. Genital warts are spread by sexual contact. They are typically developed in kids and young adults. They're annoying but pretty harmless. Remember, I'm talking about genital warts, not genital here. Again, annoying but harmless. Plantar warts are common on the soles of the feet as well as the hands or fingers or face. They can be removed by laser or freezing with liquid nitrogen or topical medications, but they usually persist even with treatment, and they resolve spontaneously over time. So when we're talking about the fact that they persist, it's because a lot of these treatments don't get down to like the root of the wart, so they don't get down deep enough to actually remove it. They'll just kind of remove like a surface level. And then again, they resolve spontaneously over time. Genital warts now, this is caused by other types of HPV that we will talk more about when we talk about reproductive. Just know that genital warts and regular warts are not caused by the same types of HPV. So if you see someone that has like, you know, warts on their hands or something like that, it's not the same as genital warts. And then our fungal infections. These are fungal infections or mycoses. They're diagnosed by scraping the skin and examining it under a microscope and then culturing the samples. Most fungal infections are superficial, but they can spread systemically in immunocompromised patients. Candida infections often happen in patients that have diabetes, and we're going to talk about candida infections again later this semester when we talk about reproductive. Tinea, this can cause different types of superficial infections depending on the area of the body that's affected. In the two types that we're going to talk about, we have tinea pedis, this is athlete's foot, and then tinea unguium. Tinea pedis or athlete's foot involves the feet, particularly the toes. You can see it on this picture, and this picture is actually also on page 156 in your book. You can get this from swimming pools or the gym if you don't wear shoes or change into clean, dry socks. Really, you can get it anytime there's like a warm, moist situation. There's normal flora, there's normal fungus on your skin, and then it becomes opportunistic or bad under warm, moist conditions. So yes, you can get this from somebody else, but a lot of times people get it from their own sweaty socks. Okay. Secondary bacteria infections can occur because, again, these are very itchy. So if you scratch and break the skin, it can lead to a secondary bacterial infection. We treat this with topical antifungal medications. And then we have that tinea unguium. So this is an infection of the toenails, usually toenails, sometimes fingernails, but usually toes. So the nail here turns white and then brown, and it thickens and cracks and spreads the infection to other nails. Then we have scabies. So scabies is an invasion of the scabies mite. The female burrows into the epidermis and lays eggs over a period of several weeks. The male dies after fertilizing the female, and the female dies after she lays her eggs. The larvae emerge from the eggs and migrate to the skin's surface and then burrow into the skin in search of nutrients. The larvae mature into adults, and then that cycle is repeated. So it causes inflammation and intense pruritus or itching. The inflammation is caused by the presence of the mite's fecal matter in that burrow. It's pretty disgusting, right? So you might even see tiny light brown lines from the burrows, and you'll see bite marks. This is spread by close contact, and it's treated with lindane, which is actually a lotion. And then we have pediculosis, which is lice. It can be body, head, or pubic. They are small parasites that feed off of human blood. They don't survive for long without a human host. Human lice and animal lice are different. The female lice lay eggs or nits on the hair shaft close to the scalp, and after the eggs hatch, they bite the human host and suck blood for survival. The site of each bite is a macule or papule that's very itchy because of the lice saliva, and the itching leads to excoriations. You usually don't see the adult lice, but you'll see the nits and the excoriations, and really if it's a bad infestation, you will see the adult lice. This is treated with topical shampoos, but lice in their eggs are very resistant to the topical shampoos. So it's important to not only use that shampoo, but use a fine-tooth comb to remove the lice and nits from their hair. It's also important to clean the clothes, linen, surrounding areas, carpets, all of that stuff to prevent reinfection. A lot of people think that just the shampoo alone will kill them and they'll go away, but that is definitely not true. So it's important that we comb them out and then clean everything that's surrounding. And I feel like we all probably itch right now from talking about this. So let's talk about skin tumors and hopefully we will stop itching, right? So first we have keratoses. These are benign lesions. Benign means non-cancerous. They're usually related to aging or skin damage. Seborrheic keratoses lead to an oval lesion that can be smooth or rough. They're usually dark in color. This is usually found on the face or upper trunk. Then we have actinic keratoses. These happen on the skin that's exposed to UV radiation. It's commonly found in fair-skinned people. These look like a darkened scaly patch. These can actually develop into squamous cell carcinoma. Some general guidelines to reduce the risk of skin cancers are to reduce sun exposure, cover up with clothing and hats, or remain in the shade. Apply sunscreen. Protect infants and kids from exposure and sun damage. Squamous cell carcinoma is a malignant tumor of the epidermis. Malignant is cancerous. So we talk about benign, non-cancerous, and malignant cancerous tumors. It's important to know the difference between these, okay? Squamous cell carcinoma is usually pretty painless. It's usually related to sun exposure, and it's found most frequently on exposed areas of the skin, like the face and neck. Smokers have a higher incidence of this in the mouth. Scar tissue can also be a source. There's an excellent prognosis when the lesion is found and removed quickly. Invasive types come from pre-malignant conditions like leukoplaskia. And then we have malignant melanoma. This is a much more serious form of cancer, skin cancer. It's highly metastatic, meaning that it spreads very quickly. It's the most lethal type of skin cancer. You might want to write that down. It's the most lethal type of skin cancer. It develops in the melanocytes of the epidermis and it forms a mole. It spreads through the lymphatic and vascular systems and metastasizes to the regional lymph nodes, to the skin, liver, lungs, and central nervous system. It looks like a multicolored lesion with an irregular border. It grows really quickly. It changes in shape, color, size, or texture. It might bleed. The treatment here is surgical removal and then radiation and or chemo, especially if it has spread. So there is a mnemonic in your module about the ABCDs of melanoma. This is important to remember. If there's a lesion or mole with any of these characteristics, we would suspect melanoma. So the A is for change in appearance, B is for change in border, C is for change in color, and D is for an increase in the diameter. And last, we have Kaposi sarcoma. It's associated with AIDS and other immunodeficiencies. It can affect the viscera, which are the internal organs, as well as the skin. The malignant cells come from the endothelium in small blood vessels, and you'll see purplish macules that are not itchy or painful. In immunocompromised patients, the lesions develop quicker over the upper body. So we treat this with a combination of chemo, radiation, surgery, and biologic therapy. And that is it for our chapter on skin.